Hello. So this semester I have decided to focus on chronic liver disease. So I will briefly cover what chronic liver disease is, the causes and risk factors, and then some interventions, both educational and policy, that have been used to try and prevent chronic liver disease. I will just start with a brief introduction. Chronic liver disease is a potentially fatal condition in which the functions of the liver deteriorate. And then the final stage of this liver deterioration is known as cirrhosis. And cirrhosis is when scar tissue replaces healthy liver tissue. And there are several causes of chronic liver disease. So heavy alcohol use, obesity, and hepatitis infections can all lead to chronic liver disease. And because of the wide range of risk factors and causes, I chose to research interventions that were aimed at preventing alcohol use, obesity, and hepatitis. So first, I will just cover some of the educational interventions that have been used. So for example, workplace interventions have been utilized. There was a 2003 study that tested a program presented to insurance company workers. And this program incorporated a substance abuse prevention program into a stress management and nutrition program. So the participants in the study were randomly assigned to receive the stress management and nutrition program with the substance abuse prevention, or just the stress management and the nutrition program without substance abuse prevention. So following the program, all participants reported positive changes on stress levels and healthy eating. And additionally, participants in both groups showed significant improvements in their attitudes and perceptions regarding substance use, regardless of the presence of the substance abuse program. So because of this, it's not really clear if the substance abuse program specifically was effective in changing attitudes and perceptions. And web-based interventions are another educational intervention that have been utilized to educate the public on alcohol misuse. And a good thing about web-based interventions, they're very useful because they allow the participant to complete the intervention at their own convenience. However, the web-based interventions that I looked at specifically had mixed levels of success. And then there have also been interventions aimed at educating the healthcare provider. So one study aimed to determine if pharmacist-led interventions were successful in increasing provider implementation of the hepatitis B vaccine. And so it was found that these interventions produced significant results amongst those working in family medicine. So now I will go over some of the policies that have been used. So regarding alcohol use, there are policies that have reduced the days and times of alcohol sales, such as not selling alcohol on Sundays. And there have also been policies that raised alcohol prices and taxes on alcohol. And previous research has shown that tactics such as higher alcohol prices is associated with reduced alcohol use and also alcohol-related problems. And then as far as obesity goes, to prevent obesity, interventions such as taxes on sugar-sweetened beverages, governing physical activity times in schools, and labeling calories on restaurant menus have been used. So between these three interventions, the taxes on sugar-sweetened beverages and governing physical activity time in schools seem to be the most effective. As far as the menu labeling policies goes, these produced mixed results. So some studies found success in labeling the calories on menus, and others found null effects. If I remember correctly, fast food restaurants such as Burger King, McDonald's, those didn't produce as significant results as other sit-in restaurants did. And then finally, vaccination policies have helped to reduce hepatitis infections. So in China, for example, mother-to-child transmission of hepatitis B is a prevalent issue. So therefore, vaccinations have been given to infants in China to reduce hepatitis B infections. So lastly, I am going to reflect on everything I learned and kind of share with you some ideas that I had that could prevent chronic liver disease. So one policy I thought of is very similar to the reduced times and sales of alcoholic beverages. Because there was a lot of success found in reducing the times of alcohol sales, I thought that maybe earlier last calls would be a good idea. A lot of times in bars, last call is 1 p.m. or later, even closer to 2 p.m. So I thought maybe if the time was just push back a little bit, maybe 12:30 a.m. Yeah, excuse me, 1 and 2 a.m. If it was pushed back to about 12:30 a.m., this might reduce alcohol consumption. And then if the bars still stayed open till 2, this could also possibly reduce drunk driving because it would give people a chance to sober up. So I think that the earlier last call could be beneficial in several aspects of public health. And then I also think more research should be done on who is more prone to develop alcoholic liver disease. So one of the things I found when I was writing my epidemiological proposal is that not everyone who consumes alcohol heavily will develop the disease. So there are certain risk factors such as gender, weight, socioeconomic status, and even the type of beverage. Consuming beer versus hard liquor versus wine can even have an impact on who develops alcoholic liver disease. So I think because of all these risk factors, it is important to research them more to discover who is most likely to develop alcoholic liver disease and who is not. Yes, so in conclusion, alcoholic liver disease, obesity, and hepatitis infections can all lead to chronic liver disease. I think I found that the policies were more effective in preventing these risk factors, and a lot of the educational preventions that I reviewed had more mixed results. So yes, that is my presentation.